we consulted with GPs over the phone, and 9 times out of 10, regardless of what the residents' symptoms were, they were prescribed just in case medication. We really struggled. I think it was months and months before we got a GP into our home.
I'd like to move on to anticipatory care plans and DNACPR. With regard to putting in place anticipatory care plans, I understand you had to contact patients, contact families, and also have discussions with residents. What was the reaction of families on being contacted about that matter?
I think we've always had anticipatory care plans, so getting in touch to update those, you know, on the back of the GPs asking to, kind of just as lockdown came into play, wasn't something that was out of the ordinary. The difficulty you then had was if the family member had said, well, if my loved one becomes unwell, not specifically COVID related, just with anything, and hospital treatment's required, then yeah, I would still like them to go. That was then the challenge, because you weren't able to put them anywhere because nobody would take them. So trying to have that conversation was really difficult, and it wasn't one that I personally would then put the families back to the GPs, because that's not on me. That wasn't my call, not to escalate that, but people were still wanting their care escalated, but were being told by medical professionals that they couldn't get it.
And
I was going to say, I mean, just as you said, I mean, DNACPRs are a normal part of care home life, I guess. There's always a discussion with people about whether, you know, which route they would like to go. But I guess there was an impression that that there was, I'm not sure that's the right phrase, but a push on by the NHS to get more of these things in place. In one of our homes, we received DNACPRs for all of our residents that hadn't already got one in place, and we had a bit of a discussion back and forward, and we actually sent them back to the NHS. But again, it goes back to what I said before, which is that's one of our homes out of 7, so there's quite different processes going on throughout the country. It wasn't a sort of unified approach. But I also think, and again, we mentioned this before, I mean, the pandemic was very busy, there were so many things going on, but I think there was a restriction in terms of access to care for people in care homes. I think that was a decision that must have been made by the NHS, but that doesn't appear, that wasn't a discussion that was held in the full public light. And I think, had it been, well, there have been people with all sorts of opinions, but you know, it seemed to be a decision that was made very low-key, not very well publicised, but was a reality of the first couple of years of the pandemic anyway.
On page 5 of the statement, I think it's a section that you've commented on, Ms. Ling. You state that you were advised GPs had discussions with families about DNACPR forms, and then subsequently all residents who didn't previously have such forms were issued with them. But despite being told by the GPs that these discussions had taken place, your impression was that that wasn't actually the case.
Yeah. I think,
what created that impression for you?
I think it was because it was very much something that was just rushed. So it was update your ACPs, your anticipated care plans, which was fine. And then it was, you need to look at who doesn't have DNRs, because they will now then need to have one. And so when that was the discussion that was had with myself, I had said at the time, well, I can't make that decision. You'll need to speak to the families about that, but I can let you know who doesn't have one. Because standard practice would be for the GP to have that discussion with the family member if the resident wasn't able to have that discussion themselves. And then, you know, within a couple of days, you then did get these outstanding DNRs that we didn't have previously. So you would question whether that was something that was done in conjunction with families, because the initial conversation was, it's just they need to have them now because they won't be able to go to hospital because they didn't want to take them.
So essentially there was no nuance. There was the conversation you had was based on there being no nuance, no individual consideration, just that everybody
Yeah.
in your care home who's resident there must have one of these.
Because they wouldn't be going to hospital if they were unwell.
Yeah. And I take it on that basis then you weren't asked about your impression of a particular resident's health and frailty as part of the consideration of whether it was clinically appropriate to put
No.
a DNACPR notice?
No, we weren't. And even when residents who did have COVID or maybe didn't have COVID just became unwell, you know, as people still continued to do throughout the pandemic, it was very much a cut and dry, you know, you got advice over the telephone, but you would have to fight very, very hard and challenge a lot to get someone admitted to hospital, when you could clearly see that if they went to hospital, they had a really good chance of improving, of getting over what, you know, was making them unwell in the first place. But it was almost like you were not playing God, but it was just, no, you can't go, so you just have to stay. And you could have gotten better if you'd been given the chance.
And your understanding is the lack of ability to access an ambulance, paramedics or hospital was the reason for these DNACPR decisions being put in place?
Yeah.
Had you ever previously experienced a time where every resident in your care home had to have this?
No.
Okay. And did the others on the panel have similar experiences, or were any of you in a care home that didn't have to approach this issue at all?
We always have DNAs in that conversation anyway. And I have a number of residents who don't have one in place, but that didn't alter.
Okay.
That
So in
didn't-
your care home,
Yeah.
you didn't have GPs contacting you saying all your
We were
residents...
told that there would be no hospital admissions, but they didn't put any extras. It remained a choice.
Yeah.
I can't comment on that, but I know that 99% of our residents do have DNA CPRs.
Yeah, I think as I said, I mean, it'd be a normal process that everyone there would be a discussion about,
Yeah,
you know,
everybody
the
has that
appropriateness of it.
conversation.
But as I say, in one case, we were issued with a blanket DNA ACPRs for all of the residents, and just as you said, that couldn't have been a nuanced discussion. There'd been no discussion involved in that.
And was your impression also that the reason for that blanket imposition was the lack of access to ambulances, paramedics and hospitals?
Yeah, I don't know about ambulance and paramedics particularly, but I think it was the pressures on the NHS and, you know, a decision, or at least a direction of travel, which was to limit the access to hospitals for nursing home residents.
I think at the very beginning, when we had it tough, when we did have very sick people who did have COVID, one conversation was that they couldn't be taken to hospital because it'd take too long to clean the ambulance, to disinfect it. So they wouldn't be going.
And I'll come back to that again. In relation to the DNA CPR forms, Ms. Ling and Mr. McCormick, did you ever have conversations with concerned family members about these? Did anyone approach you challenging this?
We had family members when their resident became unwell, COVID or not COVID related, who were concerned about why a GP wasn't necessarily coming to see them in person. And don't get me wrong, they did come out in person at times, but again, overwhelmed themselves. So it wasn't that they didn't want to come. I think sometimes just their workload meant that they couldn't. But the family members would become concerned about why, that after they've been seen by a GP, but why are they not going to hospital? And that's where the challenges would become. And because the family members then couldn't get necessarily in touch with the GP directly to have that discussion, we were the ones that kind of took the brunt or tried to explain. And how do you explain that? Because wasn't our decision, and you didn't necessarily agree with it, but we took the forefront of dealing with that, really.
So they challenged about hospital and GP care in general, but not specifically about DNA CPR decisions in your experience? Okay, thank you. Do you recall how long the blanket ambulance ban was in place? I think you mentioned, and you say in your statement, that for a while there was a ban on ambulances collecting patients, residents from care homes?
I think as the pandemic went on, so after sort of the first lockdown and into maybe towards near the end of the second, then we did have a few residents who did, probably just before the vaccine rollout, and we did have a few residents that did go to hospital, but that was quite a long time after it started, really.
Yeah.
Yeah, months.
Months. Okay. And you mentioned that there were times where a particular resident, your impression was that a particular resident had a good chance of improving if they received hospital care, but that wasn't allowed. Do you think that that led to otherwise preventable deaths?
I don't think you could really answer that in all honesty, but you know yourself from working in that environment, when people are poorly, COVID or not COVID related, if they've had courses of oral antibiotics or treatment for things and are improving a little bit but not quite improving the way you would want, if the family, that was their wishes for escalation of care, then in any other circumstance their care would then be escalated to hospital to try IV therapies or, you know, different kind of interventions that in a care home setting we just aren't able to do that.
Yep.
We couldn't really probably 100% say, but I would like to think that, yeah, there would have been some residents who would have gotten better if they had the opportunity to go to hospital.
Yeah, I mean, over any one person you can't really say, but over a number of people, it must have made a difference.
Thank you. Now, I think, Ms. Ling, I think it was you who said that you were able to get GPs into your care home.
Yeah, they came in.
Did the others have the same experience, or with it, Ms. Curry, in your experience?
No, we
GPs
didn't get any GPs in. We consulted with GPs over the phone, and 9 times out of 10, regardless of what the resident's symptoms were, they were prescribed just in case medication.
Okay.
We really struggled. I think it was months and months before we got a GP into our home. Didn't get any GPs in. We consulted with GPs over the phone, and 9 times out of 10, regardless of what the resident's symptoms were, they were prescribed just in case medication.
Okay.
We really struggled. I think it was months and months before we got a GP into our home.
We were fine. We have a very good GP service and they supported it. Without their support, you know, they were really on it from the very beginning in terms of testing and trying to stop the spread.
I think again, as I said before, there's quite a mixture of reactions, you know, so with 7 homes, there were 7 different GP surgeries, some of whom didn't come, some of whom did. I mean, they're all available. I mean, I think, you know, they were available on telephone, etc. So it wasn't a complete cessation of service, but it was delivered in quite different ways.
You mentioned that often all that would happen was that just in case medication would be prescribed. If it was something more mild, were you able to get things like antibiotics and
we were
milder
able
treatments?
they prescribed antibiotics, but 9 times out of 10, if a resident didn't get better from that, it was just in case was prescribed.
Okay, thank you.